The common signs and symptoms are increased thirst, frequent urination, increased hunger, unintended weight loss, fatigue, blurred vision, numbness or tingling in the hands or feet, slow healing sores, frequent infection, areas of darkened skin, usually in the armpits and neck. Screen yourself at age 35 if you don't have any symptoms, or even earlier if you have any of the following risk factors: BMI more than 23 kg per meter square or severe obesity, if your parent, sibling or child has diabetes, history of heart or blood vessel disease, hypertension or blood pressure more than 140/90 mm mercury, high cholesterol level, your triglyceride level more than 2.8 millimole per liter, HDL level less than 0.9 millimole per liter, woman with polycystic ovarian syndrome, physical inactivity, darkening of skin fold usually in the armpits and neck, patient with prediabetes with HbA1c more than 5.7%, impaired glucose tolerance or fasting should be tested yearly. Patients with a history of diabetes were diagnosed in the second or third trimester of pregnancy. Persons with HIV. The capillary plasma glucose test can be used as a screening tool. This testing can be done irrespective of the timing of prior meals. If your screening tests are normal, repeat screening in 1 to 3 years, or sooner if you have symptoms or risk change. You may have prediabetes or diabetes if your random capillary plasma glucose is more than 7.8 millimole per liter or fasting more than 5.6 millimole per liter. A confirmatory test needs to be performed by one of the following methods. 1. Fasting plasma glucose. Number 2. Oral glucose tolerance test. Number 3. HbA1c. Fasting plasma glucose and oral glucose tolerance tests should be performed following a minimum of 8 hours overnight fasting. HbA1c tests can be performed at any time. Prediabetes is when your HbA1c level is between 5.7% to 6.2%. Or fasting plasma glucose is between 6.1 to 6.9 millimole per liter, or 2 hours post-OGTT between 7.8 to 11 millimole per liter. Having a HbA1c level over 6.3% or fasting plasma glucose over 7 millimole per liter and 2 hours post-OGTT more than 11.1 millimole per liter indicates diabetes. However, your doctor must also correlate your history and clinical symptoms to diagnose type 2 diabetes.
The HbA1c test measures your blood sugar control over the past 3 months. It is important to know your latest HbA1c level. Higher values in percentage indicate poorer blood sugar control. Reducing your HbA1c by 1% will significantly improve your health. You will decide on the HbA1c target with your treating doctors. Ideally, it should be tested every 3 to 6 months. For young patients with diabetes who have no complications, your target HbA1c should be less than 6.5%. For others, the HbA1c target are individualized based mainly on your age and the presence of any complications, but they should not be more than 7%. Let's use a traffic light system to guide you. HbA1c level greater than 10% indicates an average blood sugar of 14 to 21 millimoles per liter. It means your blood sugar control is very poor, and you should immediately change your diet and lifestyle and optimize your treatments. HbA1c level between 8% and 10% indicate blood sugar levels between 10 to 14 millimoles per liter. Your blood sugar control is poor, and you must change your diet and lifestyle and optimize the treatment. HbA1c is less than 6.5% indicates a blood sugar level between 5 to 6 millimoles per liter. You have a well-controlled blood sugar level. Congratulations! Keep up the good work. Let's set your target HbA1c with your doctors. If you are a female with diabetes, it is best to discuss your family plannings with your doctors while discussing your target HbA1c.